Great. Welcome to the Regulatory Talks Reg Talks webinar on virtual care. My name is Diane Candiato. I'm Practice Advisor and Policy Analyst. Pleased to be here and look forward to discussing virtual care with you. I want to thank my colleagues at the college for their assistance in the development and implementation of this presentation. Today on the webinar, we have joining us Monique Poirier, our Communications Manager, who will be assisting us with Hi, Monique. You'll be assisting us with moderating questions and responding to French questions. And of course, my colleague, Carol.
Hi, I'm Carol, and it's a pleasure to be here.
Great. So Carol and I work in the Practice Advisory Program. Aside from the policy work, we answer questions and emails for the Practice Advisory Service. And we want to remind you of our resources on our website under our Members tab under the Practice Advisory Program, where you'll find our standards, articles, all our jurisprudence and professional practice resources. So why are we hosting Reg Talks? This is really to provide an opportunity for us to discuss some practice questions that we've had over the last 4 months. We know that some of you have been providing virtual care for quite some time. Some of you are newer to virtual care with the pandemic, definitely putting a spotlight on virtual care's potential. So this is an opportunity for us to clarify some of the practice questions that we've received. We're not experts in virtual care, we're learning, and this is a good opportunity for us to learn from each other. So our aim today is to explore some of these questions. We'll look at some scenarios, covering some key considerations, and an opportunity for question and answer. All right. So I will proceed with the slides. Thanks to Carol and Monique. They'll be joining us in the next sections.
So I'm going to take my camera off now.
Sure. Thank you.
Shortly.
Thank you.
Me too.
All right. All right, so hopefully you can still see me and hear me, and I'll just proceed here. So what is virtual care? Virtual care is really just client care. Sometimes we hear different terms in the literature like telepractice, telehealth, and there are different definitions. For the purpose of our session today, when we say virtual care, what we mean is interaction that occurs between clients and or their members, their circle of care that occurs remotely. So any type of communication information technology with the aim of facilitating or maximizing the quality and effectiveness of client care. So in this definition, remotely being anything that's not delivered in person. And circle of care, we're referring to the group of healthcare providers, the client, their family, caregivers, treating a client who need information to provide care. So you want to think of all the ways that healthcare providers provide virtual care. We often refer to these as virtual visits. We know that COVID-19 put a spotlight on virtual care. People in all sectors are discovering ways to operate virtually, and we know that virtual care is here to stay. Many clients like it, and healthcare practitioners do too, embracing it even if it may not have been our first choice. We wanted to take this opportunity to thank you for your service during the pandemic in caring for Ontarians. Our first principle of today's session is that while the mode that dietitians may provide virtual care may change, our professional and regulatory obligations do not change, regardless of the way that we provide care. And how do healthcare providers provide virtual care? Well, it can happen in different ways. It can be synchronous and live, audio and video in real time, just like we are right now on the webinar, or it can be asynchronous, not in real time, through written formats like emails and texting. And different ways that it happens through phone calls, video conferencing, secure messaging, remote monitoring. And in the context of dietetic practice, it might include assessments and reassessments, nutrition treatment interventions, any monitoring and evaluation related to that treatment or intervention, client and caregiver education, and that could be related to nutrition care to support client care, could be individually or in groups, and as a complement to hands-on dietetic care. It could also be replacing in-person care when a physical visit isn't possible or necessary, as we saw during the pandemic. And then, of course, other services that may be approved by employers or government agencies. So what are we going to talk about today? Key considerations when providing virtual care. We're going to focus on technology, consent, privacy and confidentiality, record keeping, and of course, our question and answer period. So when considering virtual care, the first question is, should I provide virtual care for this client or groups of clients? We urge you to use your professional judgment in determining which clients can be treated virtually, and if not feasible, who can be seen in person. Recognizing that providing virtual care requires the consideration of all our professional and regulatory obligations, such as the Code of Ethics, our standards and guidelines, legislation, and bylaws. Virtual care might not be right for every client. We need to consider the right type of contact for the right client at the right time. For example, we may have clients who don't have access to devices, or clients with hearing or visual impairments who may be better served through in-person visits. So we want to ask ourselves, would this client benefit from a virtual session, or does it need to be in person, or can it be a hybrid, perhaps partial virtual and then in person for things that we might not be able to achieve virtually, such as, perhaps a physical exam. As we saw during the pandemic, sometimes our decisions to provide virtual care are required for safety. So when choosing virtual care, we want to think about technology. How easy is the technology for the client to use and also for the dietitian to use? How can it help keep client information private and secure? So each member is expected to have that knowledge and skill, that technical competence, to use it effectively and to use our professional judgment regarding the appropriateness of virtual care at all stages of nutrition care. And this is about being current, making efforts to maintain currency, using evidence-based practice, given that the technology, we know platforms, the security functions, security measures, they all change very rapidly. And the use of that that technology requires our own education and training. We need to consider our own individual competence and the comfort and competence of the client. So what is the client's comfort level? What is their interest and desire for virtual care? Knowing that it must be aligned with the client's skill and comfort, recognizing that it may be intimidating for some clients. And also, what is the client's available technology and their history of use? We also want to think about client-specific factors. Their hearing and vision ability, comprehension, cognition, literacy, the client's environment and surroundings. Carol's going to talk a little bit more about this when it comes to the privacy and confidentiality piece. And considerations such as, accessing someone for support, someone who could provide either technical or other types of support. So we need to recognize the benefits, the risks and limitations of virtual care. When is it best to use? What does the literature say in terms of best practice? What are the technical requirements? What are the risks and limitations? And we have a duty to provide care to clients that's consistent with what we would do in person. We're adapting to a medium. And so virtual being a solution in specific situations, but we know that it's still the dietitian-client relationship that is most important. So I talked about, we're going to look at some scenarios together. I'm going to highlight some calls and emails that we received. And here is the scenario. A dietitian in private practice is exploring platforms to offer virtual care, video visits. And they hear from a colleague that Zoom healthcare is a good option. How might the dietitian handle this? Well, we get a lot of calls and emails about platforms. First, what do we mean by platform? So how is it defined? How it's defined may differ, but it really is about a tool, and that tool allows a healthcare provider to deliver virtual care. So it might include secure messaging, booking appointments, video visits, video conferencing, electronic health records. And so sometimes it varies. It could be a standalone tool or an integrated systems for delivering and documenting care. And three concepts that we want to stress during our talk today, and this applies to all the sections that we're speaking to, is the three concepts are being proactive, being reactive, and adaptive. We don't advise on the platforms. The reason being is that the technology is constantly evolving and there are so many options out there. We encourage dietitians to research just like any other area of practice. In being proactive and doing our research, that means looking at service agreements of these platforms. And taking reasonable steps to ensure that the personal health information that's in our custody and control is protected against theft, loss, unauthorized use, etc. So just like we did in face-to-face encounters, we're collecting that personal health information, we're protecting it. One way that we keep personal health information in our custody and control is by using secure and encrypted technology. And part of this proactiveness in our assessment is determining what is most effective and secure. And that's from end to end, from the security of our internet to our devices and to our platforms. So the need to protect that personal health information has never been greater. We've all seen increased portability of personal health information. We all heard about video conferencing, the bombing that was happening at the start of the pandemic. So if you're in private practice, search service providers, check service agreements, look for compliance. Is the application encrypted? Ask yourself questions like, is it compliant with the legislation? In Ontario, we have the Personal Health Information Protection Act, PHIPA, not HIPAA, H-I-P-P-A. Often we get calls, dietitians asking about HIPAA compliant platforms. That would be American legislation. In addition, we encourage you to check with your insurance providers, professional associations like Dietitians of Canada for resources, IT information consultants. They may be able to provide you with information on platforms. And knowing that we can't be experts in all things, consider hiring an expert, reaching out, getting a service agreement and contract, reaching out to a lawyer to have it reviewed. If you're employed, looking at your employer policies to see and working with relevant organizations in your organization departments, such as your privacy office, your risk management, and of course, all of our standards and guidelines at the college would continue to apply. Often organizations conduct a privacy impact assessment, and that's about collecting, using, and disclosing personal health information using an app or platform. And it's a risk management tool. It's a process to look at the effects of, on an individual's privacy. So using those devices, the platforms or apps, and how that impacts someone's privacy. Being proactive, lastly, also means developing your policies and procedures for virtual care. So you've already done that in in-person environment, how you collect and use personal health information, how you safeguard it, how you retain it, and now you're applying it to the virtual environment. So considering when you will use the technology, the requirements, how you will keep that information secure, and the operational policies for you, and how you're going to communicate that information to your clients, what to include in your policies and your statement of information practices. Being proactive and prepared also ensures that you can focus on the client. So when it comes to things like your hardware and software, your technology, good quality speakers, your microphone and headset, your webcam, your internet connection, all testing that beforehand, and then being reactive to changes. So anticipating technical problems beforehand. Will you need IT support? What type of software updates do you need to install in your computer? The importance of being vigilant, so keeping an eye out for things like phishing links and implementing the appropriate security software to make sure that scans are conducted regularly to eliminate viruses, malware, spyware. You can have a PHIPAA compliant platform, but if you're not following good IT practices, you can put your information and your client's information at risk. So things like, is your internet connection private and trusted? Are your wireless connections private and password protected? Are your devices password protected, encrypted, like your computer, your laptop? Taking reasonable steps to secure that you change as you use new technology, as new threats or vulnerabilities emerge. And so updates and changes with technology and products, and also problem solving for technical problems and disruptions. Before I go on to the slide, just a few other things is about adapting to your assessment. So, Carol's going to talk about it further, but it might be as simple as, a phone call as if your internet goes down as backup, and anticipating the need to change also as your client progresses needs and their preferences change too. So resources for your support here on the slide: the Information and Privacy Commissioner of Ontario for further information, legal counsel. The Law Society of Ontario has a referral service to assist you in finding a lawyer with health professions expertise, IT experts, professional associations, and of course your professional liability insurance provider. So we've done our homework, And let's say that we have our platform. We've determined the technical readiness and the client's readiness for the tool. And now we're going to consider the tool that we're using. It has benefits, risks, and limitations. So now we must obtain informed consent for the service, for the virtual care that we're doing, outlining what the nature, the benefits, the risks and limitations are, and what alternatives are specific to that. So you all know about the elements of informed consent. I won't repeat them here, it's in our consent standards, but now we're going to talk a little bit about consent that, in dealing with a client or a substitute decision maker and what we're required in terms of outlining for virtual care. So here's the next slide. So a dietitian is setting up a video conferencing session with a client. What are the dietitian's obligations for obtaining consent to conduct a nutrition assessment via virtual care? So we know that consent is required for two main reasons: to collect, use, and disclose personal health information. Under PHIPAA, clients always need to know why we're collecting information, how it's going to be used, and we're only collecting what's needed. And then informed consent to provide healthcare to a person, and that includes dietetic services. So that's our nutrition assessment and our treatment. So we did this in person, and now we're adding this layer of technology. We're obtaining knowledgeable consent to collect and use and disclose that personal health information. We must ensure that the client understands the technology that we're using as it relates to transmitting and possibly retaining it, that personal health information. So it necessitates that we understand the security provisions and we can sufficiently describe them to the client to obtain their knowledgeable consent. And we're obtaining informed consent to use the tool for the provision of care. So again, informed consent from the client before the session. Thinking back to being proactive, thinking back to our previous slides, our research and preparation, our policies, we might make it easy to create a short consent statement to initiate a virtual care encounter. This is something we could get reviewed through legal counsel. We could also send it ahead and read it aloud to our clients, posting information in our practice or on our website or in a client handout. The key here is that the client understands the technology and it necessitates that we understand the security provisions and we can describe them sufficiently to obtain consent. So the nature of the tool, what the client can expect, the benefits, the risks, the limitations, what alternatives are specific to virtual care, clarifying what privacy and confidentiality measures we have in place, and the client's right to refuse that virtual care. Ultimately, no platform or internet connection could ever be 100% secure. We know that we need to get knowledgeable consent and consent to conduct the assessment, and the privacy and security of a virtual visit is not guaranteed, for example, if someone joins using a public internet connection. So the client needs to be informed of these risks. We can't assume that they will know. And with regards to how we obtain consent, we remember that obtaining consent is a process. Dietitians need to use their judgment. And we often get a lot of calls, how do I get a client to sign a consent form when I'm doing this virtually? Well, the mere presence of a signed form doesn't mean that informed consent was obtained. The form might be a tool to assist us in obtaining consent. You want to think about the context of your assessment and treatment and the degree of risk to the client. So in the past, in a face-to-face assessment, would you have obtained written consent? Express written consent is required in some circumstances, like disclosing personal health information, like research projects, recording sessions, etc. Like I mentioned earlier, obtaining informed consent, we need to consider the elements of informed consent. And here on the slide, remembering that it is a process, explaining that information, enabling understanding, respecting the client's choice and decision, and enacting those collaborative processes. And that's with the substitute decision maker and the client. Express verbal consent may be sufficient for the virtual visit, and of course, documenting that in the record. In terms of resources to support, we have the consent standards that are available on our website, and we have a pandemic frequently asked question, how do I obtain consent when working remotely, also on our website. In terms of being reactive and adaptive, clients can opt out. So what if a client refuses virtual care? Could you provide a face-to-face consult? If the client refuses that to consent to virtual services and you cannot provide in-person services, making attempts to arrange alternate services for the client. And of course, documenting this in the record. Great, I'm going to pass it now over to Carol, who will continue with the rest of the content. Thanks, Carol.
Great. So thank you, Diane. Again, my name is Carol Chatwell-Singh, and I'm one of the practice advisors, and it's a pleasure to be here today. For the next few minutes, I am going to be talking about confidentiality and privacy and record keeping, and I'll ground them in some scenarios and frequently asked questions. I also want to thank Diane for advancing my slides. So next slide, please. So let's jump right into some scenarios, and also to remind you to add your questions to the chat box. So, thank you. So first scenario, a dietitian is thinking of a follow-up virtual visit with a client who says that they are not into technology. How should the RD proceed? What are some proactive considerations? So as we heard from Diane, to be proactive, the dietitian should determine the suitability for virtual practice or for the virtual visits. Virtual care is best used when an in-person visit is not required, and this is good for both an initial and a follow-up session. So the client says that they're not into technology. However, telephone technology is familiar to most. The dietitian will need to determine whether the client has access to a telephone, either a cell phone or a landline that is in a safe private setting. Research indicates that a landline is preferable. However, if using a cell phone, the risk will be like communicating in an online environment. One could get line interference, or perhaps one cell service could transfer to Wi-Fi calling if enabled. It will also be important for the dietitian to reassure the client that they are calling from, say, their work-issued or blocked number, and that they are also in a private location. When booking the appointment, the dietitian should work out a convenient time with the client and themselves, and to help the client prepare, maybe provide a time frame. For example, I will be calling between 1 and 1:30 p.m. Next slide, please. So if you were the dietitian in this scenario, in being proactive when providing virtual care, consider if your phone number is going to be visible, and if you turn off caller ID, will the client know to answer unknown caller? Reassure the client of any other security practices, such as password protection or deleting any call history. Also work through, if you do not reach the client at the appointed time, are you going to leave a message? You may want to establish this beforehand. And of course, remember to obtain and document the client's preferred phone number so you are prepared. In being reactive and adaptive, other security measures may include, at the appointed time, ask again, is this a good time? Because we know things could change. You need to clearly identify yourself, your role, your employer, if you have one, and review why you're calling. You need to verify the client identity, and research shows that some healthcare professionals request a unique client identifier, and that could be the client's name or their date of birth. Ask the client if they're ready for the conversation, and if they're in a private space where they will not be overheard. We know that it's summertime, and sitting out on the porch may not be private. You need to help the client consider confidentiality in the household and the environment surrounding them. Can family members overhear the conversation? So we heard from Diane in relation to obtaining consent, and you can include some of these considerations in the consent process discussion. If the dietitian explains the security issues surrounding communication, So they might explain communicating via internet, which would also include email and other platforms, as Diane mentioned. And the client agrees verbally or through a written process, then the dietitian can proceed accordingly. So without being mindful, confidentiality and privacy, our clients may not trust you with their personal health information. Next slide, please. So let's talk about being proactive, reactive, and adaptive with privacy and confidentiality. In this, using other formats. So in this scenario, the client did some learning and expressed wanting to try video conferencing for the next session. How should the dietitian proceed? What are some of the proactive considerations? Next slide, please. So if you were the dietitian in this scenario, you need to determine if you'll be using your own devices to deliver virtual care. For example, your computers, your laptops, smartphone, or maybe a tablet, and to ensure that these devices are password protected. For mobile devices, a mandatory requirement of the Office of Information and Privacy Commissioner of Ontario is to encrypt personal health information of clients stored on these mobile devices. As devices are prone to theft, password protection is not enough. Encryption is also required. Also consider physical measures, such as locking file-in cabinets and securing mobile devices when unattended. Also consider the security measures in your location for virtual care. Vis-a-vis in person, you close the office door to prevent others from hearing your conversation. So you want to check your location for sound leak. Can anyone hear your conversation? Or see the client during a video conferencing. Be reactive and adaptive. Have a plan for handling emergencies. Consider what you will do if there's any unplanned disruption because of equipment or internet issues. Will you move to a phone call? Will you reschedule? When video or audio quality on a virtual visit is poor, have a contingency plan. Maybe switch into a phone. And just to add, when using video conferencing, remove all distractions and unnecessary multitasking. Example, checking emails, phone messages, etc. Exercise the same extent of respect and professional judgment as conducted when seeing clients in person. Next slide, please. So the client wants to record the session. How should the dietitian proceed? We've had these questions from dietitians. Next slide, please. So if you or the client want to record the session, discuss this during the informed consent process. If sessions are recorded, consider how to store, transmit, or dispose of the recordings. Clients may think it's okay to record their virtual care without first asking. Dietitians need to have clear guidelines about whether clients can record the session and discuss this at the beginning of the appointment. Sessions are recorded only if the client provides explicit, written, informed consent. Otherwise, you can reassure the client that you will not be recording the session and suggest that they should not either. Next slide, please. So on this slide, I have listed some resources from the college's website, as well as from the Information and Privacy Commissioner of Ontario. And there are two resources here from eHealth Ontario, guides for security for small offices as well as for large organizations. So take some time to explore these resources. Next slide, please. So moving on to record keeping. Record keeping is an integral part of effective dietetic practice, and this includes virtual dietetic care. Our next scenario deals with a common question as well that we get around email communication. Next slide, please. So in this scenario, the dietitian regularly exchanges emails with her clients and refers to these emails during phone follow-up virtual care sessions. What should the dietitian be mindful of for record keeping? So email is a complementary method of communication to be used along with other methods. It is a form of one-way communication and does not allow for an immediate exchange of ideas. So in terms of documentation, next slide, please. If you are the dietitian in this scenario and communicating with clients via email, in terms of record keeping, document the client's informed consent to use email communication, as Diane mentioned. In terms of the email content, documentation may include a summary of the email correspondence between you and the client, cutting and pasting email correspondence so you can summarize the information, and or print hard copies of the email and attach in the client's health record. In terms of other forms of virtual care, clearly document any communication. You can summarize the information in the client health record, and all documentation of virtual care services must comply with the college's record-keeping requirements. So the same principles for other forms of virtual care applies as it does for emails. So next slide, please. So as a reminder around privacy, the Information and Privacy Office of Ontario requires that all personal health information that is transferred electronically, and it includes emails, be encrypted to ensure that the information is kept private and confidential. And for further information on safeguarding personal health information, on this slide has the link to some of the resources from the IPC office. Next slide, please. Another question that we get, a frequent question, is around group sessions. So in this scenario, a dietitian is thinking of offering virtual group webinars to participants. What is the dietitian's record-keeping obligation? Next slide, please. So dietitians are not required to keep individual client records where clients are receiving group education. And this applies in person or in virtual care. The exception, however, is if the client is receiving group education as part of their treatment plan. And if so, document attendance and relevant details of what was covered in the group session in the client health record. The type of information recorded for individual encounters in group session will depend on the nature of the interaction that you as the dietitian would have with the client. So things to keep in mind during group virtual sessions: certain platforms may auto-populate someone's first name and last name and may prompt user to enter their name when they join the group sessions. In addition, individuals may disclose personal health information during the session. It will be helpful to provide some guidance on the process for virtual group sessions prior to and at the beginning of your session. It would also be important to clarify with the group participants that you are not collecting their personal health information or using their personal health information, and that if they choose to disclose personal health information, there are risks related to privacy and confidentiality. And these risks can be participants and even non-participants sharing private and personal health information. A helpful hint is to consider muting the lines and chat box for individuals, or ensure the information only comes to you as the presenter. You could always suggest that participants contact you directly via phone if they have any specific questions. Lastly, regarding the names, you could suggest that the participants use an alias name or a name that they feel comfortable with being displayed on the screen, or initials, or they can feel free to leave it blank if they wish. Next slide, please. So in terms of record management, our record-keeping standards reflect the professional obligations when dietitians act as a health information custodian or as agents as defined in the Personal Health Information Protection Act, and this includes virtual care. So we've had questions from our members around the format, templates, and also ownership. So in terms of format, what formats to use when keeping records? Records may be retained in electronic format or paper format. When using electronic records, consider a reliable backup system. As we know, hard drives can crash, affecting access to records, and computers can be stolen. In terms of questions around templates, the use of templates are not prohibited. However, pre-populated templates may pose a risk to accuracy. Templates should allow for free text, or that can be customized to allow for descriptive details of pertinent information of client encounters. Pre-populating old or inaccurate information may pose risks to clients, particularly if others are using this information to make decisions. We've also had questions about multiple sites with multiple dietitians and interprofessional colleagues working together. In these situations, issues of ownerships of the records should be dealt with in a policy to ensure proper custody of records for the full retention period. And the retention period is outlined in our record keeping standards. So just a reminder that a client has a right to access their full health record upon request. Also, in terms of managing records, the concept of the word care, both in-person care or virtual care, is an interaction among the circle of care team and the client or their substitute decision maker. Sometimes the only form of communication among the team is through the client health record. So if you're working in a team, understand both the process and the format of how record keeping will occur in the team. Next slide, please. So we also get a lot of questions around billing, and the same obligation applies for virtual care. So it's important to inform the client of all available payment options, ensure a process to itemize an account for professional services if it's requested to do so by the client or the person or agency who is to pay in whole or in part for the services. Dietitians must maintain financial records whenever billing occurs in dietetic practice, and ensure your billing is transparent and your invoice indicates that you provided the services virtually. So what about out-of-province clients? Next slide, please. We also get questions about out-of-province practice. So if you're providing care to a client outside of Ontario, we ask dietitians to contact the regulatory body in the jurisdiction where the client is located to confirm any requirements. Inform clients that you're a dietitian registrant of a regulated health profession and provide the college's contact information if this is requested. Also confirm that your professional liability insurance covers you for virtual practice. Next slide, please. So finally, in being proactive, reactive, and adaptive, your professional obligations do not change regardless of the modality in which you provide care. As with in-person sessions, also keep virtual care client-centered. The college works for the public to ensure that dietitians are qualified to offer safe, competent, and ethical dietetic services, in person and virtually. Next slide, please. So we reached the point where we're happy to take your questions, and we're going to call on both Monique and Diane to join us on the screen, and Monique is going to field the questions. Over to you, Monique.
All right, thank you. So we have about so far 9 or 10 questions. So we'll start off with the first one. Are there any guidelines or contraindications for virtual nutrition counseling for eating disorders? So are there any guidelines or contraindication for virtual nutrition counseling for eating disorders?
So I think we would ask dietitians to use their professional judgment around the best practice in delivering care to this population. So best practice will say what is most effective, whether it can be done virtually or in person. It seems like we don't keep up with the research, so we depend on members to do that.
Yeah, I agree. I think it's looking at the research and determining. Yeah, in terms of guidelines, or what was the other part, Monique? Sorry.
Are there guidelines or contraindications?
Hmm.
When I think of the word contraindications as well, you have to think about um, the population that you're dealing with and the risk involved, and weighing the risk and benefits. So if it may seem more risky to provide care to this population virtually, then it's something that you probably don't want to proceed with. And so it comes back to that the first scenario that we had in terms of assessing whether the virtual care is appropriate or not.
Yeah,
So it
the
may
right
be,
contact, the right
yeah.
client, the right time. Yeah.
So it maybe with this population, a virtual practice or virtual care may not be the best, as well as it could be, depending on the assessment.
Yeah, I agree. I think it's looking at the benefits, the risks, the limitations. You know, Carol, you talked about a lot of important things too, like having an emergency plan in place, your policies, all those sorts of things as well.
Okay. Next
Thank
question.
you for that question.
Oh, okay. Thank you very much. So the next question, can you comment on the suitability of Zoom, Doxy, Skype, etc., which are good, which are not?
We get that question a lot. I think the Zoom, from what we understood, the regular Zoom wasn't considered safe. Some research is coming out around Zoom healthcare, but as a college staff or practice advisors, we don't really recommend specific platforms. Again, we ask our members to do the research around that.
The technology is changing so rapidly that it's, you know, we can't really weigh in on a platform, but yeah, we encourage you to research and to check and look for those things like we talked about, service, you know, the service provider, the compliance, is it compliant with the legislation, is it encrypted, all those sorts of things.
The members call us with a lot of platforms that they're exploring.
Shall we go on with the next
research? Yes, sure.
Shall we go on with the next question? Okay. So some of my clients forget to send their consent form ahead of their virtual appointment. I ask them to verbally consent to the appointment and will follow up to ensure I receive the form afterwards. Are there any issues with this practice?
Like I mentioned earlier, I think the form itself is just the mere presence of a form, and because someone signed it, it doesn't guarantee that we have obtained informed consent. So it's really about the process of how you're doing it. So if you're having that discussion with the client, you're talking about the risks and benefits, you ensure the client's understanding. It's that process, and then having that. Now the question would be, why do you feel like you need a written form? You know, there could be certain reasons why you have that, so to consider that. We talked about things like risk, the context of the situation, you know, when would you need that consent? Yeah, Carol, do you have anything to add to that?
No, I think that's fair.
That's good. All right. Next question.
Sure.
Okay, it says here, I am a dietitian in private practice. I work out of a multidisciplinary clinic which provides medical care by doctors, counseling by psychologists, physiotherapy by physiotherapists, massage therapy by massage therapists, and dental care by dentists and dental hygienists. All of these professions have returned to in-person care. The clinic has very strict safeguards in place. Oops, I just lost it. In place relating to masks, gloves, sanitizer, cleaning and disinfecting, physical distancing, screening, and use of non-contact thermometer. The college guidance strongly encourages virtual care and seems to strongly discouraging in-person care. Will the college's guidance be changed to allow me to return to in-person nutrition counseling with these safeguards in place?
Mm-hmm. Thank you for that question. I think all regulated healthcare professionals have the same directive from the ministry, and we are saying that you can go to in-person care if you have specific the operational requirements in place, so conditions in place to protect the client and to protect yourself. And I think from the question you mentioned all of the things that they have, the mask and the cleaning, and we have it on our website as well. We have the guidance for you if you wanted to if you determine that your client needs in-person care, that you need to follow the directive from the ministry, the operational requirements, as well as the college requirements, which are on the website. And it speaks to infection control practices. Sorry, go ahead. Did you want to add something?
Thank you. Yeah, I was going to say that it's part of that hierarchy, the hazard analysis, right? Like you're doing your point of care assessment, and part of that is, it's listed in the operational requirements is considering risk to yourself, the client. Where's the client best served? What's the right contact? Like we said, the right contact for the right client at the right time. And making those decisions based on that. Like mentioned, and it's true. Those requirements are for everyone. So.
And we're hearing from dietitians that they can deliver care virtually, and if that's an option, and it's the assessment, the patient can benefit from the virtual care, then by all means choose that as the option. I mean, the numbers went up today, so the numbers are going up and down, and we want to keep it down.
Should we go on to the next question?
Oh,
sure.
Okay. In long-term care, the homes management provides the web platform and make an appointment on behalf of the clients. Is that sufficient? What other details to consider when someone else is booking appointment on behalf of the client? Do you understand the question?
I missed the first part. Sorry,
you want
Monique.
me to repeat it again? Okay.
Yeah.
In long-term care, the homes management provides the web platform and makes an appointment on behalf of the client. Is that sufficient? What other details to consider when someone else is booking appointments on behalf of clients?
So I think if you're working with an employee, it's important to understand any policies or processes of operating or doing business. And if the employee is booking appointments, I think you need to advocate for the residents, advocate in terms of establishing a criteria or shared understanding of the process and the policy involved in booking those residents, and whether that's based on, again, risk. So the high-risk patients, somebody's in the background, maybe the policies around using the risk assessment to determine which patients need to be seen by the dietitian virtually, so they're booking these according to that prioritization.
Yeah, so I agree. It's looking at your policies and having input into that. I guess the question that I have is, the booking is happening for a virtual visit, is that correct? Maybe if the caller could clarify that for us. Just the booking. Correct.
Booking is for virtual visits. Yeah.
Is it about consent related to that the process to ensure that the client informed consent is obtained.
Yes, exactly. Yes.
Mm-hmm. I mean, that, you know, the obtaining consent is a process, again, like we said, so it could be that conversation with the client and having that opportunity to clarify, you know, these are the benefits, these are the risks, this is going to be the nature of the assessment, do you have any questions? You have the option of, you know, not going forward with that virtual visit should you not wish to, these are the alternatives, that sort of thing, and then ensuring that you are documenting that.
That helps. Thank you. Okay. Are we ready to go on to the next question then?
Sure.
Okay. So this is about email communications. What information is essential to document? Example, should I be adding the contact email from prospective clients to their chart? Also, how should emails be handled once they are received? Should they be deleted or should they be kept in a folder?
Yes, excellent questions. Yes, if the email address is important because you need to contact them again, it could be part of the record. So I would document that. You have the choice to document whatever is relevant to the client record and the client care. So whether that means cutting and pasting or transcribing or even printing the actual email and putting it as part of the record, I think that's important. And if you transcribe the email into the client health records, you don't need to keep the email anywhere. You can delete the email safely and securely.
Mm-hmm. Yeah,
I
have nothing to add to that.
Okay, next question. In answering nutrition-related questions about specific participant info, e.g. anthropometrics, in a group setting on social media or on volunteer basis, is that considered telepractice? So is answering nutrition-related questions without specific participant information, like anthropometrics, in a group setting or social media and on a volunteer basis, considered telepractice? So I guess
Think about that.
It's the question about group sessions where you're not collecting personal health information.
so it's definitely about group sessions.
Like client education, similar to our webinar tonight, where we would be, you know, having like education session and then some questions and answer, or there's no collecting of personal health information.
Yeah, it says without specific participant info.
Mm-hmm.
All right, so they're not collecting any personal health information.
They're not, yeah.
And so they're asking if.
Yeah. Sorry, Carol.
Go ahead.
We talked about some examples of, you know, where it could be synchronous or asynchronous, like so like live audio, video, providing client education. So I think it would be considered a virtual visit, virtual care.
Mm-hmm. Mm-hmm. Yeah, I think telepractice or virtual care, you don't have to have clients, like one-on-one clients where you're doing assessments.
Can be group.
Yeah, you can be providing education to groups or to the public. It all depends on how you set up your business.
Okay, so should we go on to the next question? You ready?
Sure. Yes.
Hold on a second. The next one. Any suggestions on swallowing assessments being completed virtually?
Mm-hmm. That's an interesting question, and both Diane and I, we meet with the practice advisors from some of the other colleges, and we've heard some creative ways that people are doing swallowing assessments by through video and asking the person to swallow. And maybe having someone with them to provide the consistencies.
Mhm.
But again, there's a lot of risk involved. So if you were to do this, you have to sort of weigh the risk and benefits and
Mhm.
have emergency planning. What if the client starts choking? What are you going to do?
Mhm.
But you have to like give it a lot of thought and planning around how this could happen.
Yeah, being proactive, reactive, and adaptive.
Yeah,
We
yeah.
talked about the proactive piece of, looking at the research. What is the research saying about virtual swallowing assessments?
Mm-hmm.
Being reactive, like Carol mentioned, being prepared, and then being ready to adapt.
Yeah.
Mhm. And yeah, thinking about the risks and benefits, sure, and limitations.
So we've heard that could be done. We'll
Mhm.
leave it up to the dietitian to use their judgment based on a risk assessment and having a backup emergency plan
Mhm.
and being proactive, reactive, and adaptive.
Mhm.
Okay. So next question. So can you clarify the statement that you do not need to document on group visits unless it is part of the treatment plan? For instance, in the latter case, do you need to write a formal chart note, or is evidence that they attended sufficient found within the appointment history?
Mm-hmm. That's an excellent question. So if part of the plan is that the treatment plan is that this client attends the group session, you can document that either by saying client attended the group session, and you have an outline of that group session somewhere, documented somewhere, so that you can reference it either in the client's chart or in your business plan, that when somebody attends a specific group session, these are the things that you would outline. So you can do it that way by referencing the group session, or you can put as much detail as necessary to ensure you have all the relevant information about that client's care in the document.
Okay, that's good.
Mm-hmm.
Will we be sending out the slides after the webinar today?
So we'll be sending a recording by the end of this week, hopefully, and the slides will be included.
Okay, so let me see. So here's another question. Is there a requirement to record and retain information from an inquiry call from individuals that don't proceed with a dietitian service and don't become clients? So is there a requirement to record and retain information from an inquiry call from individuals that don't proceed with a dietitian service and don't become clients?
So this could
So
be someone just calling and asking about the dietitian services, or maybe emailing, or is that right?
Yes,
Okay.
that's right.
I think the obligation for record keeping is if you have a
Mhm.
RD-client relationship
Mhm.
where
And the
you're
standards.
collecting personal health information to do an assessment, you're required to keep records. If someone's just calling to find out and you're not collecting personal health information, there's no requirement to keep records. However, if you are working with an employer, there might be some requirement to keep track. If you're in private practice, you might set up your practice in a way that you want to keep track for accounting or financial reasons. So it all comes back to your business practice or your employer's policies around these types of contacts.
And I think, Carol, like we often say, like the record keeping guidelines and standards, they, once you start to collect personal health information, that requirement of starting a record, right?
Yep.
Yeah.
Where you're only collecting personal health information to do an assessment.
Yeah.
And if you're doing assessment, there's a requirement.
So I have one more comment or question here. Are you done? Sorry, that's good.
Yeah.
Yeah,
No.
one more comment, I think. That says, obtained consent is completed upon admission to a long-term care home in Ontario. So I guess obtained consent is completed or done upon admission to a long-term care home in Ontario. It's a statement, a question maybe.
Obtaining consent, they obtain it on admission for, is it maybe to collect and use personal health information?
There's no detail.
Mhm.
Obtained consent is completed upon admission to a long-term care home in Ontario. So I guess
So I think a lot of organizations may ask clients or residents to provide consent for general admission and collecting personal health information, and maybe even treatment, but not specific treatment, because I think as a dietitian, if you are proposing a nutritional treatment, you have an obligation to discuss that with your client in terms of going through what Diane talked about, the whole process. So here's the treatment that I'm proposing in terms of the nutrition treatment. These are the reasons why this will be beneficial to you. And any alternatives, sort of the risk, material risk and side effects, and any questions that the resident or the client might have. And that is the process around obtaining informed consent for the treatment, which is a little bit different from the consent that the home might be obtaining, because that's not informed, that's not based on your assessment, that's just sort of a general consent that they may be collecting.
Agreed. Yeah.
So there's some differences.
so. That's it. Those are the questions.
7:01. Yes.
Wow, right on time.
Well, thank you, everyone.
Thank you. So we just wanted to end with this beautiful quote by Dr. Danielle Martin, and she says, "We'll learn where virtual care is most useful, where it is superior, and where it falls short, and we'll fine-tune over time." So hopefully with you together, we'll fine-tune, and we'll have more webinars, and we invite you to contact us as practice advisors. We're happy to respond via email or a phone call or a conference call, and maybe to do more of these webinars. So thank you so much. Thank you for your service. And
thank you, Monique.
Thank you, Monique. Yes.
Yes, you're very welcome.
Thank you, everyone.
We have a few RDs saying thank you here too, a few of the attendees. Thank you.
Yes.
And we'll send a survey and evaluation shortly as well.
Have a great evening,
Have a great
everyone.
evening.
Bye, everybody.
Signing off.
Bye.
Bye.
Bye.